In today's health check, we're talking about what can be a miserable side effect of chemotherapy. Numbness and tingling and discomfort in your hands or feet. And those are examples of chemo-induced neuropathy. Very common side effect of chemo, I'm told, that affects maybe 30 to 40% of the survivors. And it can last a long time. The problem is pain medications tend to provide very little relief. Local patients are taking part in a most unusual clinical trial. It uses toxins from one of the most poisonous animals on the planet to help reduce the amount of this neuropathy. Joining me now is Janine Parker from the Oklahoma Medical Center Pain Clinic to talk about this clinical trial. And it's very much needed because, truthfully, I had never even heard of this, but you said it's very common.
It's very common. 30 to 40% of patients receiving either a platinum-based chemotherapy or what we call the category of taxane will actually have the neuropathy. Common in their hands and feet, numbness, tingling, burning. Ooh. Feel like walking around on pinpricks.
And you were telling me that perhaps the answer might be in a very dangerous toxin that comes naturally from a specific creature.
It comes from the pufferfish. This is, and it is a very high toxin, but it's actually Botox. The toxin used in Botox, botulism, is 200,000 times more toxic than the pufferfish toxin.
So you're not using botulism in this, you're using pufferfish.
We are, but it is much safer than even what Botox is that is commonly being used.
Okay. And how effective has it been so far, or can you even tell?
Well, we've had several patients enrolled. Our first patient in the state of Oklahoma first enrolled in August, so it's new to us. It's been open since 2012 in the United States. And they've had patients that have had decreased pain and symptoms for 6 to 8 months. In our patients, we've had reports of decreased pain and able to use their hands more, where they couldn't use their hands previously, or carry or things around. So it is working, and it seems to be very effective, and the side effects tend to be very transient, little numbness and tingling in their fingers or in their hands, mouth, and that usually is gone by the time they've left our clinic.
Now, if somebody wants to participate in your clinical trial, what do they need to do, or who would be eligible?
Well, usually it's patients who have had chemotherapy that for such conditions such as lung cancer, breast cancer is extremely common, and with being Breast Cancer Awareness Month.
Yeah, good timing.
Good timing. It's colon cancer, it has bladder cancer, so there's quite a few different types of cancers. Ovarian cancer is a big one.
So do they need to be in treatment now?
No, most of these patients have finished their chemotherapy. Some of them we're seeing are just a few months out from their chemotherapy. Some are years, because it can continue for years.
Okay. Well, we hope we can get some answers from these clinical trials. And if people are interested in volunteering to help you out, we've made it easy for you. You go to our website, KFOR.com, and we'll take you directly to their website so you can find out exactly what you need to know. Thank you so much for coming.
Thank you. Appreciate it.
Hope it turns out well.